Hello everyone, welcome to CouchCon. My name is Imi-chan, and this week we are going to be talking about mental illness. I felt compelled to do a PSA sort of show due to just some interesting colloquial things that are happening, particularly in some of the weeb fandom, and more specifically during people's panels. I'm noticing a tendency to use diagnostic language in a non-diagnostic setting. So what do people think when they hear that people have a mental illness? Commonly, people think that they go to just any old doctor and they are given a diagnostic title that comes from the Diagnostic and Statistic Manual, and with that title comes some sort of magic treatment, a pill or a type of therapy or maybe electroshock or something like that, and then they get better. Unfortunately, most mental illnesses are chronic. A lot of them require 3 or 4 kinds of treatment, some talk therapy, maybe some behavioral therapy, maybe some antidepressants or antipsychotics, or anti-anxiety medication, or any number of things. Sometimes things like yoga and exercise programs and changing routine, plus therapy help. Sometimes you end up on a series of medications, and people have varying opinions about drugs treating mental illness, of course. So one of the stereotypes of mental illness is that once you are diagnosed with a mental illness, you end up in a mental institution or a hospital, or some kind of clinical setting where you need very intensive care. And this can happen for individuals who have late diagnosis of things like schizophrenia. They're often discovered because they do something unusual or potentially dangerous to themselves or others. But just because you are thinking you might have depression, or you've realized that situations make you anxious and you might need help for that, that doesn't mean that when you go and ask for that help, you're going to end up in an intensive clinical setting like a mental hospital. For the most part, if you tell your GP will give you a list of therapists in your area, possibly those who take your insurance. For those of you who are here in the United States, where healthcare is kind of crap. Or they can offer to treat you with some very common drugs to see how those affect your behavior and your well-being until you can get the help you need from a mental health professional. But just because you have anxiety or depression, or you're feeling out of touch, or you're a self-harmer, does not mean that you're going to end up in a mental institution. For the most part, the system is there to keep you out of those institutions and get you the help you need before it gets to that level. There is a new trend in Hollywood to try to make mental illness seem glamorous and to make mental hospitals seem like spas.
Lisa, stop it.
Stop what? You fucking peek. Look at this. Go ahead. Go ahead.
That's enough.
Take one fucking step and I'll jam this in my aorta. Go ahead. Go ahead.
Stop it.
Lisa, your aorta is in your chest.
Good to know.
Another trend is blaming mental illness on one's creativity, the weather, or the season. Obviously, seasonal affective disorder exists, and vitamin D deficiency, usually seen during winter months, can affect how the symptoms of depression present themselves and how severe they are. And yes, there has been research stating that individuals who do suffer from chronic mental illnesses do tend to be more creative in that they tend to express those through creative endeavors such as painting, sculpting, songwriting, poetry, novel writing, things like that. But that does not mean that each individual who is creative has a mental illness, and each individual who has mental illness must be, a secret genius artist who's just, choosing not to express it. Everybody's a unique individual who has their own way of coping with what life throws at them.
It's jungle out there, disorder and confusion everywhere. No one seems to care. Well, I do. Hey, who's in charge here? It's jungle out there, poison in the very air we breathe. You know what's in the water that you drink? Well, I do. It's amazing. People think I'm crazy, 'cause I worry all the time. If you paid attention, you'd be worried too. You better pay attention, or this world we love so much might just kill you.
NAMI tells us that approximately 1 in 5 adults in the United States experience a mental illness in a given year, and that 1 in 25 adults in the United States will experience serious mental illness in a given year that will substantially limit their ability to participate in major life activities. Also, 1 in 5 youths, or those aged 13 to 18, will experience severe mental disorders or illnesses during their lifetime, and children, that's individuals who are age 8 to age 13, approximately 13% of those will experience severe mental illness in their lifetime. 1.1% of adults in the United States have schizophrenia, 2.6% of adults in the United States live with bipolar disorder, and 6.9% of adults have at least one major depressive episode per year. So this is a significant portion of our population that we are choosing to alienate with the language that we use. So what can we do to improve things? One of the major things we can do is to limit the hate speech we use when speaking of the mentally ill. There are many great resources that are attempting to educate people and to change the way we speak about mental illness. Make It Okay is an amazing resource, and I suggest it for anyone who has a mental illness or knows anyone with a mental illness or simply wants to be a better global citizen in regards to the mentally ill. Finally, NAMI can help you find professionals in your area who can help you to understand your individual illness.